Hi everyone, how are you? All well? Good. I don't know if Kirstie's here yet. I can't. It's like talking to a room full of people with paper bags all over their heads, but I can't see anyone. But before we start on the vaccination stuff, because Kirstie's going to kind of lead that from Eastleigh, I've just come off a call about systemic support for us around outbreak management, because we're being told that there are an increasing number of serious outbreaks across the county and that numbers are dangerously rising faster than predictions. They're predicting 13 days away from peak surge and have asked us to come out with as Devon Care Homes Collaborative, a set of guiding principles to ensure that homes remain protected. So we're going to try and work on that before Thursday's webinar. But I just thought I would maybe just bring to your attention that the NHS numbers that are being predicted are getting worse by the day, and the level of available support to outbreak homes from the LA under the Care Act is not like it was in lockdown 1. I know this weekend alone there were 3 homes that were left in dire straits because of a lack of availability of staff. One of the projects that we're going to start this evening with local authority partners is looking at group recruitment through Proud to Care or some other channel to recruit a central team. If anyone's got any administrative support or anyone within your organisation that could help with that project, essentially we've suggested that recruit 20 care staff, get them inducted next week and have them around the county so that we can support each other. They've also asked around the concept of mutual aid, which was discussed at Care Home Forum last Tuesday and will be picked up again this afternoon. If anyone's a mutual aid, meaning that we support each other with processes and staff should our services break down. It comes from the notion that, so I don't mind sharing that we've got a very major outbreak in a 95-bedded home in South Wales that starts on the 16th of December. We're currently at 31 positive people, predicted at 40 out of 95. We haven't lost anyone yet, but we have some very, very sick people. We were able to muster 26 staff that went from across other services to Wales and started there last week. It's along that concept. My Somerset service was cooking for my Monmouth service and things like that. So we're looking at putting together a mutual aid package to support homes that that perhaps may need it. If you're interested or got any resource at all that could help with that, please just send me a message. Is Kirstie here or? Right, Lucy, do you want to?
Hi.
Hi, Kirstie's not here, so I'll do the introduction. So obviously today was called around vaccine support. Isabel, do you want to just give Kirstie a call and see if she's ever able to join? So the webinar that was held, electronically or physically, whichever, let's just go with it now, for a short time, which, did you guys run the, go to the webinar last week that was run by DCC and the CCG? So that during that webinar, I sat there and thought there were lots of questions that we're asking as providers. There's obviously some angst and uncertainty about what needs to happen. So I thought it would be helpful to have a Zoom call because we can talk to each other as opposed to a webinar where you type questions and you can't ask some follow-up question. So I'm not pretending we've got all the answers here today because this isn't our rollout. What we do have is a number of people on this call that have done it. Kirstie Barnes from Eastleigh has kindly put an amazing presentation together. So I won't steal her thunder. As soon as Kirstie arrives, I'll let her do that. But anyone who's, sorry, send that silent first. Anyone who has completed a mass vaccination, feel free just to share how it went. I think, Lucy, you've done one, haven't you? Or at least
yeah, we've done, our staff were all done, so to speak, just before Christmas, the 20th of December. We were summoned to Clare House in Tivis, and I think Sarah from St George's as well was part of that cohort. Amazingly organised. It was one in sort of a one-way system. We didn't have long to get them together. So talking from a staff point of view, and apologies to the lot of you who will have already had your staff vaccinated, but we obviously already had the consent forms in place. The main thing we needed to find out from all of ours was about whether they'd ever had a serious anaphylactic shock to any other vaccine before, or penicillin. And a couple of our staff were rejected for the vaccination as a result of that. So that's been interesting, and they've been okay with that. But that did take a bit of managing, because they were very keen to be vaccinated. But I was very impressed with that from a staff point of view. We were all booked then to do our second dose on Sunday, and a few of our staff had a text message saying that they would have that appointment. However, as a result, the PCN, Clare House and Amicus Health Trust decided to use essentially the stocks that they would have used for our second dose to vaccinate as all the care homes they could. So I think, as far as I'm aware, they're the only PCN in Devon to fully vaccinate all staff and care home residents. They've done it, everyone. So they came out to Bampton, where we are, on Friday, and they were very fast. We basically stacked them up. So we had all the consents ready. We'd given them the numbers of who was able to get down to the lounge and who was in their bed. Please jump in if you've got questions, sorry, because I'm just waffling on. But all the ones we could get into the lounge, we sort of took them in 2 by 2, essentially. They got their verbal consent, they had their paper consent, and then they vaccinated them, and then we took them into the dining room for their 15-minute observation. And then they went and rattled through the people in their beds. The only heads up on that one is that, and it makes total sense, but they just hadn't sort of warned us that they'd be as quick as they were. So they did 7 of our bedridden patients, again, within about 3 minutes, just rattled through. But we needed 7 members of staff to sit with those residents, and that took everyone off the floor and more. So it's just worth thinking about that when you're staffing up, when they do come to your home, because you are going to need to assign those resources for that 15-minute observation. And it was fine, we were able to do that, but that would be my only learning point from it all. None of our residents have had a reaction to it. They haven't had, I mean, I had a dreadfully sore arm, as did lots of our staff after our staff vaccinations, but none of the residents have had any reaction at all. They've been, now what that means about whether or not they're building an immune response, I don't know, we're not going to speculate, but it was fine, it was good. And the well-being of everybody, the mental well-being, just knowing that everyone's been vaccinated has been great. It's been a real boost over the weekend. So
Lucy,
hello.
Gail Eardley, can I just ask, you mentioned penicillin. That's not a contraindication, an allergy to penicillin. That's not.
It's not, and I don't think they use that at Clare House either, but I know that at Musgrove they turned a great swathe of staff away who'd had an anaphylactic shock to penicillin. Some of our staff, a couple of them, have had reactions to penicillin, and they've been allowed to be vaccinated, but anyone who had an anaphylactic shock was not allowed to. So we've got
so it's the anaphylaxis opposed to
the anaphylaxis, not the penicillin.
That's not the barrier. The cautionary note was the severity of your penicillin allergy needs to be assessed by a medical practitioner. So if it's a light rash allergy, they are now vaccinating. But
if you needed adrenaline, that's the indicator.
Sorry, it's Lorna.
Hi, Lorna.
Hi. Was that the for the residents? Was that the Pfizer vaccine or the Oxford?
Pfizer.
And so in the webinar last week, they were talking about limiting the amount of movement of the Pfizer through the building. Is that correct?
Absolutely right. So we actually lost one vaccine because they couldn't move the vial once they'd opened it. So we had 2 members of staff who were kind of new additions to our staffing team, and they were on the kind of last, we'll get to you if we've got enough vaccine, and that neither of them were able to be done. They actually got vaccinated on Sunday in Clare House, but once the vial was opened, they were only allowed to, I think it's 5, don't quote me, but I think it's only 5 injections they can use, and you cannot move that vial around. So there was 1 extra shot left, and they couldn't use that for one of our members of staff, which is a shame. It comes down to regulations. I don't understand the finer details, but it basically, the UK regulations are a lot tighter than anywhere else. So most most other European countries are getting 6 or 7 out of their vials, and we're only allowed to take 5. That's how I understand it, but I may be wrong.
Could I just interrupt you there? We've got our presenter in the house now, so if we could get Kirstie to, because a lot of these questions run through Kirstie's amazing presentation. So Kirstie, hi, welcome.
Hi, I'm really sorry, guys. I got the wrong meeting in my diary, so I do apologise.
No problems. Can we get you to, is Bella, you sharing the presentation or?
No, Izzy's going to do it for me. So she said she'd be my next slide, please. I said, new job.
Okay, hopefully that works for you.
You didn't do this for me last month, so I'm gonna note that. Thank you.
Right, so I happen to just pop Shreen a message because we have 3 large care homes, 2 in North Devon and 1 in Somerset, and we've been very lucky through Friday and Saturday of last week to actually have all of our residents vaccinated. So I am going to talk predominantly about Devon, but there are some bits in here that I will talk about Somerset, because I appreciate there are some of you that do cross boundary along with us. So I thought I'd walk through the whole journey because Shreen shared with me a spreadsheet of questions that came out of your last meeting, and some of the information was actually to do with sort of the consent and pre-vaccination day. So I've tried to do it in different processes. So we kind of start from the beginning. So next slide, please. So from a pre-vaccination day, there's obviously the issue of consent that causes a lot of people concern. So I've split it into 2 sections because my background actually is mainly employment law and HR. So that was my primary background. So you've got to make sure that for your staff, you've got sufficient employment records, etc. So you need to make sure that you get your staff consent forms signed and retain those to their files. Now, I know the guidance has changed around people not needing to be excluded from the Pfizer vaccine if they are pregnant or breastfeeding or trying for a child. However, what I would say is our experience this weekend was that the team don't trust the potential of that new government guidance and are still leaning on the fact that the initial guidance was that you shouldn't have it. So those people still are choosing to wait for the AstraZeneca. So this was written last night as the new guidance came out. The other thing you've got to identify is any staff who are themselves on anticoagulants or have a previous anaphylaxis or are an EpiPen carrier, because those people will have to either be excluded or be identified to the vaccinators and the pharmacist on the day. So residents is obviously the hot topic. So what we did in each of our homes was we split our residents into sort of 4 primary cohorts. So you had those who had capacity, and the resident was supported by one of our team to complete the forms that are in the link at the bottom of the presentation, which are the government forms. And where we had a couple of residents that we were not completely certain on, we completed a decision-specific capacity assessment to evidence that we'd followed that through fully to comply with the best interest process. We then split them into people who had no capacity but had a lasting power of attorney in place, and we got the lasting power of attorney to sign the consent, and where we couldn't get that because we moved so quickly, we actually in some instances had to get a email with the consent form attached to it returned to us to say that they did consent because we couldn't turn it around quick enough. On the day, they do ask to see, in all of our homes, they did ask to see a copy of the lasting powers of attorney to evidence that we had the required information. We then had people who had no capacity, no lasting power of attorney, but did have a family or representative that could sign. Now, I know in Devon, they were quite happy for the care home manager to make this decision, but CQC do look for us more to have somebody from outside of that process, where there is a family or a representative, to sign the form. And what I would say is Somerset do want to see that form. So there is a difference. There's quite a lot of disparity actually between the 2 counties already. And then you've got the people that have no capacity, no lasting power of attorney and no representative. And outstanding practice here really is to liaise with the IMCA or the care funder to advise of a plan to complete the best interest. So we sent emails because we're evidencing to CQC or to anybody else that we've involved all the multi-disc team that could be involved with that person to help with the best interest decision. And we tried to get the GPs to be the final decision maker. Somerset were far better at that than Devon. Devon pushed back, despite Shreen sharing the document with me that suggests that that was going to be how Devon were going to do it. When the vaccinators arrived on the day, they said they knew nothing about it. So we were basing on that. So that was 4 cohorts really. Next slide, please. So there's a little bit of pre-work that we found worked really well. So you've got to look where you're going to vaccinate. So there needs to be enough space for the vaccinators. You should have an understanding of how many vaccinators are going to be coming. Our homes were quite big, so we ended up with 4 vaccinators in the South Molton homes, and we had 2 vaccinators in the Somerset home. You need, either they will bring an administrator or you need an administrator to help manage some of the bits and pieces. And then you need an area for the resident or the staff being vaccinated, ideally seated, or a space for a wheelchair that should be socially distant. So we actually took over one of our dining rooms and had in Minehead, because I was in the Minehead home for it, and took the vaccinators on either side of the dining room. In the South Molton homes, they split them into 2 areas and they had 2 vaccinators and then an administrator in each of those areas. The vaccination areas need to be minimalised as much as possible, because you need to have the smallest number of moves of the vaccine once it's on the premises. So they carry in pretty much like bomb disposal, really, in a sort of a cold case, and they're sort of walking like, you know, it's going to explode at any moment, and then they have to put it down onto a table or an area that it can then be surrounded by other tables or against a wall, so that the vaccine is not knocked. So you need to really be thinking about how you're going to map that vaccine into your home. Where is going to be the primary point of administration, which should be where the main vaccination space is, and where you can get everybody who can mobilise to that space to come to that space to have their injection. The only people that should be outside of that are those that are bedbound or room dependent. And the reason I say room dependent is we have a number of expressive people that it would be too distressing to move them multiple times within the home. So we actually were very lucky in the fact that we had a conversation and we had 2 moves within our home, one for the primary area and one for our people who were expressive, so that they were vaccinated in their family area, in the area where they felt comfortable. You've got to consider the tables and the surfaces for vaccine administration where it's not in the main area. So where we have people that were bedbound, we were using an area in the corridor for the vaccine to sit, which was a central area to then walk a very short distance from there to the home, to the various bedrooms to do the vaccinations. So, but you need to make sure that you've got a table or a clean surface there. They will ask you to make sure that it's virusolved off, so that they have confidence that they're placing the vaccine onto a sterile surface. Where the room where the vaccine is stored, it became evident, you know, you really need to make sure the heating's not on, and wherever possible there's a flow of air through it, because it can't be overly hot in that area. Our homes tend to be particularly warm, and the vaccine can be very fragile. So they do want you to try and keep the ambient temperature of the room where the vaccine is going to be as low as possible, really. Taking into consideration you have got residents coming out in and out of that area as well. You need a PPE station, vaccination stations. So you need the 2 vaccination stations, and then somewhere in the middle you need a PPE station so that they can change their PPE. Very interestingly, Devon was following the new guidance that you had to change your PPE after every resident. Somerset was saying it was sessional. So Somerset weren't bothered, they were happy to do it sessional. So there is differences. You need a bin, obviously close by each of the vaccination stations for disposal of PPE after donning and doffing. So we just put a clinical waste bin, and where we didn't have that in one of our homes because we didn't have enough, we just got a disposable cardboard box and put a yellow bin liner inside of it, because that was all we could do at the time, because we didn't know until they arrived with us. You need an administrator table, which is enough to hold a laptop, your home consent documents, and any other in-house documentation that you may have that you want to be documented at the time. You need to have the potential for 2 to 3 administrating staff, depending on the size of the team. As I said, in our 2 South Malton homes where we had 4 people, we had 2 administrators. In Somerset, we had 2 vaccinators, a GP, and I ended up being the administrator because they didn't have an administrator. So, but the GP had to have their laptop so that they could link in to care records if needs be. You then need to develop a separate area for observation post-vaccination, because what should happen is that your vaccinating area, your residents will be brought into the vaccinating area, they will be vaccinated, they will leave the vaccinating area ideally and go to an observation area which is close enough to be triaged and receive emergency aid, but distant so that you can keep a flow of residents happening. Okay, and they were quite keen in all of our sites for that to be large enough to allow social distancing. Next slide, please. Something that we almost got caught out on was to think about lunch timings. You know, if you're using all of your areas, or you've got people, they won't stop for lunch particularly. They'll just want to push on through. So we did manage to get them to protect a small area for lunch, but we shuffled our lunch timings to maximise the flow of the vaccine and try and get it through. So it's just something to consider. The other thing to think about is your shift timings. Think about staff that are not naturally rostered for the vaccination day. Think about people that may be on a half-day shift or a short shift if you're not running a 12-hour shift, to make sure that they will vaccinate all of the residents first, and then the staff will usually be bolted in at the point that they are doing the bed bound, or the staff at the end. I've just seen the comment, yes, they bring their own sharps bins. So you don't have to supply sharps bins. They also do supply their own PPE. So what I did in all of our homes was we had our fire floor plan that we printed off, and we highlighted up all of the residents that were bed bound or room dependent, because this helps the vaccinators on the day to understand visually how your home works. They don't know your homes. We know our homes really, really well. So they need to think about, if you've got a very large floor of staff, if you've got residents rather, if you've got 6 residents in one area that are bedbound, and then you've got 1 right at the other area, they won't be able to bring that person in because it's too far to travel. They'll literally walk about 10 paces from vaccination point to giving it to a bedbound person. So we had it in the corridor, and then we had a little cohort of 5 residents from that central point that they could walk to quite quickly to actually do. So you've just got to think about that. And then where you've got a resident that is outside of that area, you've got to think about how you can cohort your staff to bolt in to use that vaccine up. So each vial in each of our homes got between 5 and 6 out of each vial. So you've got to think about where we had this one resident that was on their own, I had to have 5 other members of staff ready almost outside of the room to have their vaccine at that location to use the vial up, because obviously it's vitally important that we maximise the vials that we used. So because we obviously are a really large home, and we had, I mean, the South Malton, the Rallymead home did 149 people on Friday, the East Street home did 93, and Minehead we did 93. We had stickers, so just self-adhesive stickers and a marker pen that we were putting on people as they were being vaccinated, and I'll talk about that in a moment. So you need to make sure you've got those ready if you want to adopt that route. Identify your residents on anticoagulants, because in Devon, they said they needed a 30-minute observation post-vaccination, not 15 minutes. In Somerset, they really didn't mind. You need to identify your residents that have potentially expressive behaviour, so that you can pass that over and forewarn your vaccinators on the day. It will also reduce chance of safeguardings, guys, if you're very upfront about a resident that can be expressive, or their room is not to the standard, or they're not at the standard of cleanliness that you want them to be. I think it just reduces that chance because of their behaviours. And also think about those that have got allergies. They'll want some notes and cards within the home when they arrive with the Wi-Fi code, because you'll need to pass that for the vaccinators on the day. It's just speeding up when they get there, getting going, really. Clarify with the vaccination team that they will be lateral flow tested on the day of vaccinating and that they will bring their own PPE. Interestingly, we had quite a heated discussion with one of our vaccinators in Devon, who arrived and said she was positive 4 weeks ago and therefore she didn't need to be lateral flow tested. And we're saying, well, it doesn't matter, PCR tested, you get the break, but lateral flow testing, it's continuous. So that was quite difficult. So you just need to clarify that they're definitely going to be lateral flow tested on the day. You need to identify a coordinator to organise the consents into an easy identifiable order that that person can work through, because believe me, it's like the Grand National. They're off, they're running, you've got people coming all over the place. It's organised chaos. So you've got to make sure that whoever is your identified coordinator knows the home, knows the residents, knows the staff, knows the flow, knows what you're going to be doing, and can be your advocate for your residents and for your team to keep the pace and to keep everything working. I've just in the note that's just come up, the vaccinating team do their own LFDs in the morning, so they wouldn't wait in any section for us to do a lateral flow. They've said they've been lateral flow tested in the morning and they come in and they work on that basis. You need to develop a staff and a resident list to check off who's received their vaccination, because as I said, you think it's going to be great. We have bed lists, so we went with a bed list and a staff list, because doing it myself and being the administrator and the coordinator on the day, they are going through so quickly. If you don't have that to quick reference and tick, very quickly you'll lose who's been done and who hasn't. We informed all of our families and professionals. We suspended visiting to the day, requested no calls. So because literally it's all hands on deck because it's just so busy. Somerset only had a completely separate NHS form that they wanted completing for the day. This was West Somerset. Whether it will be different anywhere else in Somerset, I don't know. I was lucky that I'd done the piece of work and I was able to populate those forms the night before. Otherwise, if they'd had to be populated on the day would have been more fraught than ever. So, Devon just used the consent forms, and they wrote on the bottom of the consent form that the vaccination had been vaccinated on that day, and they've asked us to keep those for next time, where they will add the next section on. Next slide, please. So staffing. We cohorted up our staff. If you've got the ability to cohort up your staff, you need to, because you've got to think of staff that are going to be doing the daily, looking after residents and the bits and pieces on the floor, but then you need to have staff to be your farriers, to be bringing residents to and from the vaccinating area and from the observation area, so that there's a couple of people that can be doing that flow management. You need to make sure that you've got adequate staff to complete the observations. We did some flashcards. I'll share them with Isabel afterwards to send out with this. You're more than welcome to use them. So we had just some flashcards around anaphylaxis identification. So when you had somebody standing with a resident, it was very easy for them to identify soft signs as well as more clinical signs of anaphylaxis. You need to think about when you've got your residents that are bedbound or room dependent, they need to have one member of staff stood with them for 15 minutes and not a member of staff that's had their vaccination, because they could have an anaphylaxis as well as the residents. So it should be somebody who's pre-vaccination or post-vaccination observation. We had to think, just a thing to think about, the right skill mix to support your expressive residents. We made sure that I had my behaviour specialist working in each of our homes, so that we had somebody there to support the vaccinators and support the residents pre, during and post. We saw a number of our expressive residents feeling a little bit uncertain and a little bit expressive after having the injection. Plus, it's the volume of people, it's the volume of noise, it's the volume of just, you know, frequency and everything happening on that floor can be quite disruptive to those people if you're not careful, because they don't identify with that. Identify your staff into cohorts to make sure that they themselves have 15 minutes post-vaccination observation, whilst still allowing the home to have sufficient observers for residents and to keep the maintenance of the home, to keep, you know, your residents being looked after. You need to tell your staff in the morning and before the vaccination day will be really busy, and everybody's just got to rally with the team. And it is fraught, but it's great, but it's very fraught. The biggest thing is to identify a really strong, competent vaccine coordinator from your team. It's got to be somebody who really knows your residents and the staff, knows the home, and can keep the flow on the day. They need to know about the consent process. They need to know about the consent filing for really quick referencing. But they've also got to be somebody that is strong enough to say to the vaccinators, stop. The observation area is too full. People are getting too anxious, because otherwise, from our experience, the vaccinating team will just keep going. They just keep pushing, which means that it really potentially puts you at risk of safeguarding or issues. You also need to consider staff contingency if the staff present with post-vaccine symptoms. Now, we had 3 homes in obviously 2 days. One home, the Minehead home, only actually had 30 staff vaccinated because they didn't have enough vaccines to do everybody. But we had no sickness at all, no issues, no afterwards. The staff carried on working, though everybody came in over the weekend. My big home in Raleigh Mead, it's a much larger cohort of staff that were done. We managed to do, I think it was about 80 staff in that home. They had 9 sickness the next day. I do think there was, to be honest, an element of some people jumping on the bandwagon, you know, talking very openly, but there were some very genuine people in there. Symptoms presented as mild flu-like symptoms. People were having quite bad and vivid dreams on occasions. People had a bit of a sore arm. They were feeling a bit malaised. And in the East Street home, we did 53 staff and we had 2 members of staff sick. So, you know, you do have to build in, particularly with us, it hit at a weekend when you naturally have sickness anyway. It's just something to build in. We also found that some of our residents had some symptoms, but I'll talk about that in a minute. Next slide, please. So, vaccination day, large coffee, possibly a Valium. I think that might be good, if I'm honest. It's pretty, you've got to come in buzzing and ready for the day. So the first thing is obviously set up your vaccination room, get it exactly where you want to do, get your anaphylaxis help cards out to the staff. All your residents need to have short sleeved loose fitting tops for ease of the vaccination, so that they can get to it nice and quickly, so that it just helps the flow, so you're not trying to undress people, dignity and respect as well in a communal area. It is recommended, Somerset were keen on this, Devon not so much. We are taking our residents' temperature anyway every day, but I would certainly recommend you take everybody's temperature in the morning, pre-vaccination as a baseline, so that you know that they were well and they weren't running a temperature or anything before, because this will be vitally important afterwards if somebody starts to become poorly. Be really clear on the resident flow. We sat and we identified which residents we would be putting in what order, and we had a list which allowed everybody to be clear on who was next. It's always mobile residents first, then your bedbound or your room dependent. Try and have at least 6 residents ready to go at the planned start time. Ideally, if you sat waiting in the vaccinating area, we had some of our residents who had capacity sat waiting, and we were doing the whole you're the first in our home, trying to big it up, so that they were quite excited about it. Because once it actually gets going, you just need to have people waiting, because honestly, they fly, they really do. Have a room plan to hand, cohorted bedbound room dependent residents and the staff that you're thinking about that would be in the vicinity to complete the vaccination vial. Work on the 6 vaccine administrations per vial. The team will look at that with you and will work out how to make sure that they have the least travel, and they will just coordinate that with you on the day. I would definitely recommend somebody senior welcoming the vaccination team and to completely clarify and be very clear on their lateral flow test status. Assess their PPE and make sure they're donned before accessing the building. We did have one person that tried to access without any PPE on and said they would don when they were in the building, which they were turned around and told to don before they came into the building. Next slide, please. So I would suggest you take them to the vaccinating area, show them the floor plan, give them the Wi-Fi codes, advise them that whoever is supported by the in-house coordinator for fire purposes and orientation. This all needs to be done before the vaccine is brought onto the premises. I find if they try and walk in one of the homes, they tried to walk in with the vaccine first of all before this had been done, and somebody was trying to hold the vaccine while they were changing their mind about where they were going to put it down. So we clarified that quite quickly. Then it starts, guys, the vaccination's up and running. Okay, so once they start vaccinating, the reason we had the labels was we labelled each of our residents, and a lot of our residents quite a few of our residents had capacity, said they liked having a label. They said it was like being at the doctor's years ago where you used to get a little label. They quite liked it. So, but you put the observation start time and the finish time, which is 15 minutes for all, which means that anybody who's coming in or helping with the flow of residents is very clear when that resident's observation time is finished. You need to plan and get them labelled before they move from the vaccinating area to the observation area. Somerset were keen on this, Devon not so much, but we followed it anyway. Even if a resident has a minor reaction. So we had a resident who we know does suffer with some sort of reflux, but obviously the stress of the situation brought on some reflux. So we kept them in the observation area for a further 15 minutes because you don't know if their presentation may be the start of something. So they were observed then for 30 minutes. As I said, caution, watch the flow. They absolutely fly. You've got to be careful with social distancing and overcrowding of the observation area because the vaccinators aren't in that area and they will just keep pushing them through. And if somebody's not saying, whoa, 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 it's getting too crowded, it's getting too busy, you'll end up with an issue. Okay, you need to make sure that somebody is in the observation area, obviously doing the anaphylaxis observations, but somebody in there needs to be strong enough to make sure that they coordinate the move on of residents as they complete their observation stickered time. We adopted a proactive use of paracetamol for the residents that had it PRN post-vaccination to help with localised pain and possible reaction very positively. That's your choice. That was our decision that we were going to do that. So I think there were, in our Rallymead home, we had a number of residents who spiked a temperature post-injection. It's very interesting, that home, you know, being very open and honest with you, is a home that we had a high number of residents who were antibody positive. So we don't know if that was the reason why that home reacted as it did. We're not sure, but it did help. They will give you vaccination cards for your staff that you need to make sure the staff have, because that is their evidence that they've had the vaccination. You obviously need to document on all of your residents' records that they've had their administration. And then I would definitely recommend continue resident observations post the observation time. We had a lot of people that just were not themselves. You know, their temperature popped up. We had then triage escalation protocols for up to 48 hours post-vaccine, so because it was a weekend, so that my clinical team and my senior care team knew what to do, how to engage with 111 and or 999 if needed. Next slide, please. You're done. That's it. You've actually done it. But the downside is you've got to do it all again in 3 to 12 weeks. So, what's their question?
That was amazing. Thank you. I think we all now have a step-by-step guide. How do you feel at the end of it?
I'm a couple of days post now, so I can breathe. But it honestly, I can't. It's fab on the day, but it's fraught. You know, it is just bang, bang, bang. It's so fast-paced. we've got, not all of our staff did have it. We've got a lot of people, younger ladies who are very apprehensive about having it. So they're waiting for the AstraZeneca. This information obviously came out post about pregnancy, etc. But we've gone back and revisited with those people, and they said, how can the government say at one point you can't have it, and now all of a sudden they've changed it? Are they doing that because, you know, they want everybody to have it? So I think they will wait for the AstraZeneca.
The pregnancy, the study on rats is now reported, and there was, if I remember the wording right, I think I put it on the WhatsApp group, a snippet from the report that said that there was no adverse reactions in the rats, and the fetus was found to have antibodies for COVID-19. And so that's why they're recommending for, the recommendation is actually for projected complicated pregnancies that people should seriously consider having the vaccination. I had a couple of, I've talked to more staff about babies than I've had in my career, but I've talked to a couple of mine about, if you're planning on getting pregnant, would you not rather be protected in order that your unborn child is protected, and just wait a couple of months? And that seems to have been a winning.
So the bit that I'm frantically trying to find out is what happens now for us, because we're vaccinated, and we had some people who were in hospital or new admissions that nobody can give me an answer how they're going to be vaccinated.
We asked Sally Slade that question in the webinar and on Penn meeting yesterday. We suggested with Darren Alcorn that they have a special care staff clinic in the acutes that they run once a week that we can do for new staff, and that new admissions to a vaccinated care home are vaccinated on discharge from the acutes. Apparently there's a meeting next week to...
Yeah, so the problem we've got is the acutes don't know that.
No, they haven't agreed it yet, so apparently there's a meeting next week, but hopefully they will agree. The conversation that I had with one of the acutes was it's not an acute activity, it's a community activity. So we may well get into a challenge there.
So I'm just looking at some of the comments. So the anticoagulants from Lucy. Some of the issue with anticoagulants as well is the fact that people are being stabbed with a needle, so you know they'll bleed more as well. So you just have to be careful at site.
That comment about the LFDs, Lorraine Webber did say on the webinar last week that if you want to LFDs test vaccinators, then you can request that. It should just go in your pre-vaccination call as a request. So, for example, I said on ours that our policy is to wear hairnets. So please just explain that will be happening, and they were quite open about that.
The only other thing being sceptical that has come out this morning is we had one of the vaccinators was the infection prevention control lead for North Devon, and she insisted on walking around the home, and subsequently she's now raised all these concerns of everything that we're not doing to the standard that they want. So just be cautious about that.
You were lucky you had an infection control inspection at the same time, double one.
Yeah.
For the price of one.
Yeah. So
did they write you an action plan as well, or was that?
Yeah. No. But yeah, it's just having everything in place. I think we did a lot of work and got most of this in place with what we thought. And to be honest, the days worked well. There definitely was staff sickness, and there definitely were residents that were affected. So that's just something you have to consider.
Okay, anyone got any questions for Kirstie? Feel free to shout out.
Yeah, I've got one. I dropped off with no internet for 10 minutes, so I might have missed it. But we've got some residents who've got capacity, but verbally can't communicate and physically can't complete consent forms. Has anyone had similar issues, and what level of test do the vaccinators want to see to go, okay, we believe this person does have capacity?
So with us, they wanted to, they asked if it would have been referenced in the care plan, and they wanted some evidence. You could sign it on their behalf, and you would have to evidence that you had done whatever non-verbal communication this person would normally communicate with. They were happy to accept that. So they wanted to see, they asked the question, was it referenced in the care plan? I said yes. I said that we'd done a very detailed note on the day that we'd done our assessment with them, and documented clearly, contemporaneously on that time that we'd done it and what we'd done, and they were quite happy with that.
But Mark, don't forget that every professional should be operating Principle 1. So if you're saying that person's got capacity, then and they say they haven't, we'll ask them to cite the concerns that they have, or they're not following Principle 1.
All right, thanks, guys.
Can I just confirm, Kirstie, what the vaccine was? Which was it, please? Because I missed the beginning. Sorry.
Pfizer.
It was Pfizer. Yeah, thank you.
Yeah, they literally, honest to God, they carried it in.
Yeah, they would.
It was honestly, it looked like she was carrying Bad Boys, the film, you know, it was quite funny, really.
It's very unstable, isn't it? The Pfizer vaccine. That's the trouble. Thank you.
Anyone else got any questions that want to throw at anyone that's had vaccine experience?
I was just going to ask, Kirstie, thank you for that. And just as I said on the chat bar, just a broad brush, roughly how many people vaccinated, how long did it take overall, just to get my head around the time frame that we might need to provide for?
So it depends, I think, how many vaccinators you've got. So if I'll talk each home to give you some ideas. So we have 4 vaccinators for the 2 South Molton home. They arrived in South Molton and were off by 9:30. We actually had one member of staff who had a severe anaphylaxis and was hospitalised, but that's because of pre-existing medical conditions. So that slowed them down, but they were finished vaccinating there by midday, and that was 106 people, including residents and staff. They then went across to the Rallymead home, started vaccinating at about 1:15 and did 149 and were gone by 6.
Okay.
In Minehead, we did 93. They arrived here, I suppose we started vaccinating about 10:10. They had a 20-minute comfort break in the middle, and they were done and dusted by 3:20.
Okay, that's really helpful. Thank you. Thank you very much.
Cool. Well, if there aren't any other questions, did everyone find this useful?
Yeah, very great. Very helpful. Thank you.
Yes.
Does anyone want to do it again?
I've done it
It
now.
would be helpful if we could have the slides.
It's true, we've done it now. A bit of a silly question, wasn't it? I meant about other issues. Actually, my head thinks one thing and it doesn't come out my mouth. It appears that this, and I find that really useful. Really, hopefully, my managers that are on the call will follow that advice. But for the next round of things, it might be that we do one of these sessions on business continuity planning and just share those of us that have hit dire straits, actually what we did at that point. And I'm just worried that over the next few weeks, if we do get more and more homes that don't have staff on the floor, how we're going to keep people safe. We will share the slides on the WhatsApp group. If you're not in the WhatsApp group, please send info@devoncarehomes.org an email, and Isabel will kindly respond to you.
Anaphylaxis card as well.
Yeah, we can share that card and the PowerPoint presentation. All right.
Can we put those on the website as well, Izzy? That'd be a really good resource. Most people there as well.
Yeah, we're for those of you that are registered, we are going to start putting stuff into the members area once we've got that site up and running, so it'll be a lot easier to access stuff. Cool. All right. Well, very nice to see you all, or not see you, but hear some of you. And we'll speak to you soon. Good luck with vaccinations.
Okay, thank you very much.
Right.
Bye.
Bye.